In Zimbabwe's Shona language, they say, Kuchembera ndo kwandinotya, expressing the fear of end-of-life tragedies. We explore issues around dementia, which is one of the most feared conditions of old age. Dementia symptoms are characterized by difficulty in remembering and impaired language, communication, and reasoning. With different stages of dementia, the symptoms may differ with each stage.
In terms of symptoms, the ones that people particularly know about or people are able to recognize is memory changes, particularly the forgetfulness. But of particular importance is that the forgetfulness doesn't start with big things. Sometimes it's forgetfulness of very little things that people start doing. Some people start forgetting where they put their phone, they start forgetting where they hid their money, and then this gets worse gradually over the years. And now sometimes they end up getting lost, they don't know their way home, and when it is really, really severe, they start forgetting even familiar faces or people that are around them. But memory is not the only thing that is affected in dementia, although this is the most common thing. But things like even being able to recognize things, common things that we know about. Someone who has severe dementia, if you ask them even a simple pen or a watch what this is, they might struggle to be able to tell you what it is, because there are so many different parts in their brain that have changed, and being able to actually name things for them becomes difficult. There even are physical symptoms that people can have. They can start struggling to even button their shirts, and you find that it is done wrongly, or even tying their shoes. Those little activities are also affected even in dementia. Even concentration is affected. You find they always have poor concentration sometimes.
Erika Mutiwasekwa, who is a daughter to a 92-year-old patient, recounts how her mother changed when none of the family had any knowledge of dementia.
Ndakaona kuti waingokanganwa tiri pamba, like makeys waisha kuti waisa pai makey. Ndakavabvunza futi ndaida kunzi ndichiziva kuti mari dzavo dziweke ngawana pamombe dzavo dzeumhai, dziweke ngawatengesa, notakata watitengesai mombe dzenyu dzeumhai, monodya mari yenyu. Saka wakadzitengesa. Ndakuvabvunza manje kuti ko makatengeiko pamombe dzenyu? She couldn't explain. Kana kuti uziva kuti mari yacho wakaifambisa sei? She could not explain. It was not like her. And then the other thing chandakanotisa ndechekuti waitokanganwa kana kudya chaiko.
Sleeping disorders are the order of the day for most dementia patients. A patient may sleep from 10 p.m. to 3 p.m. the next day, a stretch of 17 hours, or may not even put their head on the pillow for those hours.
Mukawasiya vanokwanisa kusvika na 4 p.m. wasina kumbomuka. Saka ndakazodevelopa strategy yekuti kuti wamuke time yamunoda kuti wamuke, munoenda moti mai ine zvimbomukai mumboenda kunze. Apo vanozvinzwisisa apa munoziva kunze kune vanhu vechikuru. Imbomukai mumboenda kunze, vanomuka havanetsi. Asi ukada kuti mai yangu yekumuka havamuki, vanokurambira chaizvo.
But what exactly will be happening in their mind?
There are changes that happen to one's sleeping pattern, particularly in dementia. There is a phenomenon that we call the sundowner phenomenon that sometimes happens in terms of sleep. This is when they actually struggle more and their symptoms get worse as the day goes by, and then they actually start having problems when of sleeping. They wake up during the night, and sometimes they start acting out their dreams, and they wake up and they start walking about when they're actually supposed to be sleeping.
Then we move on to eating habits, very bad eating habits, that one would wonder how a patient is finding the strength to move about after refusing to eat the whole day, alleging that they would have eaten. In some circumstances, they would complain of hunger just after a meal, assuming they did not eat.
Vanotombokanganwa kuti vari kudya, votoramba vachingovakurudzira kuti dyai, chivankurudzira kuti dyai. And sometimes kana riri sadza vanokwanisa kuti vari kudya sadza vangoti naro havachadyi muriwo, havasi kuziva kuti pane muriwo, wati aiwa idyai nemuriwo uyu, votanga kudya muriwo, ungoti nawo havachadyi sadza. Saka vatoramba vachingoti mhai torai sadza nemuriwo modya.
Eating habits can also be changed, but mostly the eating habits are for people with dementia, because they prefer the changes that happen around the home sometimes can affect them, because this is someone who's struggling with their orientation, sometimes knowing where they are or what they're doing. So once you have too many changes even to their food, sometimes they struggle with that, and they start having sometimes narrowed preferences of the type of foods that they actually want.
It is said that due to lack of knowledge of dementia, many elderly are accused of witchcraft. It is all about the symptoms aligned to the condition that may not only confuse the patient, but also the people around.
We went to Warren Park 2, where there was a lady who was diagnosed with dementia. Those houses, they are mirror images of each other, and the bathrooms are located outside. So at night, when she wanted to go and relieve herself, she went outside, used the bathroom, and forgot how to go back to her home. Because the other house is a mirror image of where she lives, she went and entered the other person's home. She's old. She even forgot to pull up her pants. When she entered the home, they thought, what can you picture? Someone comes into your home, you're naked, in the middle of the night. And they've heard stories that she forgets, she wanders. So it was pointed to witchcraft, and yet it wasn't. It was an issue of that she couldn't tell where she was supposed to enter.
Later on, when it becomes severe, they get more of psychotic symptoms where you don't understand each other, they're seeing visions, they're hearing voices, and they keep walking around, pacing aimlessly and wandering about. So all those things also need to be managed and understood by the caregivers.
Vanozouya kuno kazhinji vanenge varambwa nehama dzavo. Dzimwe nguva nokuti zvimwe zvavanotaura zvinenge zvisinganyatsoita zvakanaka, zvimwe zvinotyisa, saka kuti vachizogara navo mudzimba dzavo kana kuti vavasiye nevana vavo, vanenge vakutoona kuti hazvichaiti. Saka kana zvazodare izvo manje, vazhinji zvinenge zvakunzi anoroya, hamoni zvaanoita here, but dzimwe nguva kurwara chaiko, nokuti isusu kana tazosangana navo pana patagara navo munonyatsoona kuti chokwadi vari kumudaro zvavo, asi munhu haana kumbodaro. Akapinda mumba make kurara, akawana chekudya chake kudya, but kuzongorasika pakutaura ikoko.
Are forgetful, so they might never remember that they have a condition, especially when they are in their very severe decline stage. It is due to this situation that confusion will hit them. Depending on the stage of dementia, some may not recall their own children or siblings and may not recall whether they were married or not.
Mai iko zvinezvi havachatombozivi havo kuti munhu yake mbenga akaroorwa aine murume wake, havachapazivi ipapo, general havachapazivi. And havachazivi kuti wane vana wapi wacho.
Mazita acho handichazivi.
Hamuchazivi kuti mama akaroorwa kupi?
Handichazivi kuti ndakaroorwa ndinoziva kuti ndakaroorwa mumhiri mamucheke.
Asi hamuchazivi kuti kunonzi kwani?
Kunonzi kwani. Ndozvinondinetsa izvo.
Hamuchazivi kuti munonzi mainzi mai.
Ndakambotaurirwa hangu, asi zvino kuti ndizvitaure ndakanganwa, handichazivi.
Kumazita hamuchazivi here vana venyu?
Aiwa ndichazivi. Aiwa ndinongoti mwana badzi.
Munowaziva here mukawaona vana vacho?
At some point, a patient's mind is switched back to their childhood, starts believing their youth, yearn for their mom, who in their mind would have traveled somewhere. That will be a 92-year-old patient.
Zvakanga zvakaitika kare kare ndozvavari kuremember. Zveye zvine zvavacharemember. zviri very strong in her memory ndezvenguva chiri mwana mudiki chisikana chiri pamusha naana mai wake nevanin'ina wake nehanzvadzi dzake ndozvavanoririmember very strongly nekuti mazuva ese vanongobvunza kuti mai vangu vari kupi, mai vangu vambouya here.
Anterograde memory, which is the memory of the now. So when the individual is being affected by dementia, they easily lose the now memory. Hence, they tend to live in the past. They now remember the events that happened in the past more.
Sometimes people who interact with dementia patients may not notice that their beloved one is slipping into dementia in the early stage of the condition. Only time will tell when the impaired judgment of the patient deteriorates to the point that it will be impossible for the independent day-to-day life. Since many people do not understand dementia, when symptoms start to show, the elderly are unfortunately on the receiving end as relatives shun them. Bumudzo Old People's Home, a Salvation Army institution that was opened in 1974 to cater for the sick and homeless elderly persons, has had very emotional moments with inmates whose dementia condition was actually triggered by abuse from relatives.
Varipo vanoita hasha, vamwe vacho vazhinji vacho zvavakasangana nazvo muupenyu zvakavaremera zvinovaita kuti vaite hasha, sokuti mumwe anenge anga aine imba yake obva atorerwa imba yake nehama kana kuti nehama dzemurume osara iye asisina chaainacho. Paanongoramba achifunga pamusoro pazvo izvozvo zvinomukanganisa pfungwa. Saka kana ari pano, vamwe vacho anobva vatanga kuti inini ndoramba ndakagara pano here ndichichengetwa pano, ini ndandine imba yangu, ini ndandine basa rangu, ini ndine musha wangu, ndine mombe dzangu. Saka izvozvo anenge achifunga pamusoro pezvinhu zvake zvitoripo. Saka vanhu ngavangonzwisisawo nekutarisa hama yavo upenyu hwaakararama. Kana vakazoona akurasika, zvimwe zvakonzerwa nokufunga pamusoro pezvakaitika muupenyu hwake.
Patients may ask the same question repeatedly, thrice in less than 5 minutes, and we will need the answers. You don't tell them they are repeating because they do not know that and will never remember, even if you repeat reminding them. An analysis of the symptoms indicates that patience is the virtue when we think about carers or associates of people suffering from dementia.
Aparariwi. Vanhu vachamboenda kundotora mwana wangu ari kupi? Kana ukamboti mwana atirwa nambuya unda alright. Umbodzikama. Kusari kwambopera kana 5 minutes ndichamboenda kundotora mwana wangu. Aiwa kani mai, mwana atirwa nambuya alright. Umbogara pasi. Wachingoripita, wachingodaro. Saka ndakazoona with passage of time kuti kana watanga kudaro zvandinoita manje, ndinokiya madoors emamwe marooms, ndowapa room yekufamba zvakaita mupassage iri mumba. Wachiti wakavhura dhoo iri wotadza, wakavhura dhoo iri wotadza, wombodzoka mubedroom, wachingodaro wachiti ndikutsvaga mwana wangu, ndongwasiya wakadaro. After about 2-3 hours vanenge vaneta, wobvuma kurara. Asi hazvipereri ipapo. Kana warara unoona kutanga kutarisa dhonzo, dhoo harina kukiyiwa kai, dhoo harina kuvhariwa kai. Wazoti aiwa mai ndakiya dhoo kani, vanzi aiwa ndoda kundotarisa ndega. Woenda wosvika wovhura, vanzi rakakiyiwa nai. Woya wodzoka worara pamubhedha. Wangakwanisa kudzokera izvozvo 10 times. Zvino ndakazoona kuti aiwa handiite nharo nawo, ndovasiya wakadaro. Vanosvika pakuneta wozorara manje.
The condition may not be changed, so the question is, how can the situation be managed by carers?
Tanga kuma 5-6 ndipo vanenge vakutanga kuita energetic, wakungofamba up and down. Uona kuti katemba kaya kanenge kachinja manje. And ukaona vakunetsa kudaro zvatinowanzoita isusu tinovaregedza vakadaro. Kuti wakafamba stereki, wachitaura stereki, in an hour or 2 vanenge vaneta. Unozoona settle down.
With people who have dementia, there is sometimes the disorientation. So sometimes they don't know where they are. They don't know what time it is. They don't know what year we're in, what month we're in. So therefore that disorientation sometimes can be very destructive to them. Therefore, some of the examples of the things that the association would help the caregiver with learning, knowing, being able to understand those symptoms, but not only that, how best to manage them, things like changes, So it is not good for you to be moving a person who has dementia from one home to another, constantly traveling with them, because it means that disorientation is going to be worse. They're getting to a new place, they have to get accustomed to it. So minimizing the amount of changes that you have to do around the home, or the activities that you even do at home, such that they have somewhat a routine. But also another thing that's important is that in as much as dementia has to do with changes in attention, concentration, and memory, they also tend to have other mental disorders. Things like depression and anxiety are also common in people who have dementia. Sometimes the depression in the person who has dementia comes early on when they're diagnosed, and they realize that I am actually losing touch with my surrounding and what's going to become of me. And later on, when it becomes severe, they get more of psychotic symptoms where you don't understand each other. They're seeing visions, they're hearing voices, and they keep walking around, pacing aimlessly and wandering about. So all those things also need to be managed and understood by the caregivers. But because now this person has had changes to their activities of daily living, sometimes they are unable to cook for themselves and they will get lost if you leave them. Therefore, it means they need constant attention. So sometimes the burden of caring for someone with dementia becomes a huge toll on a caregiver, and they can also have stress, they can also get depressed. So therefore, that support is also necessary.
Culture may seem to be a deterrent to freedom in societies, and many a times people will despise development or shun help as long as it is regarded as a breach on ethics. In African culture, it will not be proper to send your parent to a caregiving facility lest you live with a curse.
It's not in our culture to send our elderly to an elderly people's home. We feel it's our task to take care of them. But then in taking care of them as well, we have the nitty-gritties which we need to do here and there, and then we end up to be overwhelmed with the care itself, and then end up sending our parents or grandparents to the rural homes. It's the African society. If you send your parent to an elder people's home, they'll think, warasa maivako. We are very young. We're still trying to take care of ourselves. And then you have to take care of someone whom you're supposed to be looking up to as an adult to you. And you have to go to work. You probably have got kids. Now you've got a bigger kid at home. It becomes stressing. And you then think of, let me get a nurse aide or someone who can come and take care of my mom at home. And that new face can be agitating to a dementia patient.
Due to stigma, dementia patients are not given the attention they need for their condition. Awareness programs are of great importance for the betterment of dementia patients and their caregivers or relatives.
Tinogona kugadzirwa that program pamwe through government or whatever. Ndizima sectors anogona kutibatsira kuti vanhu vanyatsonzwisisa kuti zvinhu zviri kukonzerwa nei, kuti vakwanise kubatsirika. Nokuti iko zvezvo vamwe vanhu tinongovatarisa chingoti anorwara kana kuti neimwe nzira tototi vanotorowa.
Hurumende inokwanisa kupindira, yopindirawo, yogadzira magrupu anenge achifamba kumamisha kupi achitenderera achidzidzisa vanhu magariro ekuita nevanhu vakura. Nokuti dzonguva unoona muchembere chaiye ane kana svondo rese kana mwedzi asina kutogeza kana kushambidza muviri wake.
Vese vari kushanda nevanhu vakadai ngavawanewo ruzivo pamusoro pechirwere ichi, kuitira kuti kana vawana vanoziva kuvabatsira. Zvakasiyana nekare, nokuti chirwere ichi kwatirisu vanhu vatema hachisati chakunzwisika zvakanyanya. Kazhinji tinongoti ari kuzviitisa nechikonzero chokuti achikura taimuziva state yake, achitaurawo zvakakwana zviri normal zvakadii. Saka iko zvinezvi kana zvaakuitika, vanhu vanofunga kuti kwaakuchembera, haagone kutaura, haagone kugara nevamwe zvakanaka. Kana zvadzidziswa kucommunity ka, tinogonawo kuzodzidzisa vana vedu kuti varege kutiza mbuya kuti sei vari kudaro.
We offer support groups for both the patient and the caregivers. The caregivers we're talking about, it could be a family setup. The family whom the patient lives with are also caring for their person. Or it could be like a professional caregiver whereby you have nurse aides at home. So it would be both the patient and the caregiver. We're giving them support, their support groups whereby we give them more information on the condition. The more you know about something, the better you can manage it. And we also offer counseling, as in some people, it becomes so hard to accept this is what my parent is going through. So it's counseling for both the patient and the family members and the caregivers as well.
Sometimes the burden of caring for someone with dementia becomes a huge toll on a caregiver, and they can also have stress, they can also get depressed. So therefore that support is also necessary for caregivers, particularly because of the burden that they can likely get in taking care of someone with dementia.
Every creation needs love, and so do human beings. Dementia patients also need the society to love them, though they might not remember your affection, but that will help them to live well. Always remember, they also love.